For bronchoscopy, non-invasive ventilation, I think it's really a great tool. This is the technique we use for hypoxemic patients in whom we want to do bronchoscopy. We use the Buciniac CPAP system, which is very interesting because it's an open system, so you can go through it and you still have the positive pressure. Other people use the face mask and add some sedation. In this study, it was a propofol target-controlled infusion in hypoxemic patients. And other people use the large full face mask to more easily perform the bronchoscopy because you need some skill to introduce the bronchoscope after passing the mask. The use after extubation, I would say, is maybe in the same group. I do think that using non-invasive ventilation after extubation is interesting, but it should be used as a preventive tool. Not in everybody, and you see this randomized trial which showed that there was a huge benefit in hypercapnic patients, but no benefit in other patients. So I don't think it should be used in everybody, but in selected patients as a preventive technique to avoid worsening, I think we have very strong data to support that. And that's about the same for prevention of postoperative complications. There is like a gray zone between a curative approach, which would be only when the patient has respiratory failure. I would say it's probably too late. Or prophylactic approach in everybody, and it's probably too often. So you have to decide, like in this study, which patients could benefit, and they decided that patients who become hypoxemic after major abdominal surgery will be randomized between CPAP delivered with the helmet or classical physiotherapy and oxygen. And you see that the rate of intubation, the number of complications was markedly decreased by using the prophylactic CPAP